Welcome to 𝗠𝗷𝗶𝘀 podcast by Emirates Hospitals Group. My name is Dr. 𝗠𝗷𝗶𝘀 I am a consultant pediatrician at Emirates Specialty Hospital, Dubai. Our goal at 𝗠𝗷𝗶𝘀 podcast is to update you with the latest advancements in medicine, aiming to improve health and well-being. Today, we will speak about joint replacement. What is new in this field, what is happening all over the world, and what is happening in Dubai. And my guest for today is Dr. Paul Jairaj. Dr. Paul, welcome to 𝗠𝗷𝗶𝘀 podcast.
Thank you very much.
Please, can you introduce yourself to the listeners?
Yeah, my name's Dr. Paul Jairaj. I'm a consultant orthopedic hip and knee surgeon. I'm UK trained. I did American and French fellowships. And I'm now working with Emirates Hospital Group, specifically at the Specialty Hospital in Healthcare City and also in the Marina.
Yes, so welcome to our podcast, Dr. Paul, once again. What hip and knee conditions you treat?
So my entire practice is purely hip and knee surgery. I don't treat anything else. And essentially the way I sort of look at things is I look at patients and who complain of hip and knee pain. And what I'm trying to work out is exactly where they are on a spectrum of essentially damage in the joint. So either it's patients who've got early disease in their hip and knee joint, in which case we can investigate and treat with Keyhole techniques, or alternatively, unfortunately, there are patients with very significant damage in the joint and they require joint replacement surgery. And we're doing things a little bit differently by doing 3D planned customized implants for these patients.
Oh, wow, that's very, very specialized. That's brilliant, actually. So you mentioned keyhole hip surgery. What is that?
So keyhole hip surgery is where we're catching patients early in the disease process. So they might have cartilage damage, and our investigations have shown that. And after a course of therapy, we are then able to move ahead with keyhole hip surgery to treat that early cartilage damage. And what we're trying to do is prevent them getting hip arthritis and consequent joint replacement surgery. This is something that I've got a very special interest in and really have come to Dubai specifically for that, as well as my joint replacement practice.
Actually, we are lucky in Dubai to have you, and we are lucky more and more in Emirates Hospitals Group to have someone with this expertise and these new techniques in hip and knee surgeries. So you've mentioned also 3D joint replacement. So how is this different than the traditional or the standard techniques for joint replacement?
So joint replacement surgery has been around a long time and the technologies have been moving forwards. However, we are still left with an issue with that, being the fact that most implant companies make their implants in literally 6 or 8 sizes. And that has to fit the entire population. And this is the same for hips as it is for knees. So what's come from that is actually trying to reconstruct patients' anatomy. So we're using 3D imaging technology. We have special 3D planning software and allows us to match implants to fit patients or even make implants that just fit them exactly. So truly customized and bespoke to that patient.
Oh, that's really great. So this is a very important, of course, benefit for this 3D technique. And any other potential benefits when it comes to the patients?
Yeah, absolutely. So what we're finding with this 3D technology is that when we have an implant that fits exactly into that patient, that they are making much quicker, faster recoveries. So an analogy would be with standard implants, it's rather like having several sizes of, say, Crocs shoe, for example. So they all get bigger. As each size gets bigger, every parameter gets bigger. The problem is we've all got very differently shaped body parts. And so the thing is that you could quite easily be between sizes. And this is what happens with the implants. So by scanning the patient beforehand and getting this 3D picture and model of them, we can then make an implant that fits them exactly. So it's as if you've got a bespoke, custom-made shoe or suit or whichever way you want to look at it, which of course is a better fit, which means a faster recovery and a better functional return to activity.
Yes. So there's so much there. This is really wow. But can you give me some details about this surgery? Really, I want to know a bit
most
more.
People don't really want to know exactly what happens in a joint replacement.
What exactly happens?
But basically what we do, so in a hip, the hip's a ball and socket. And quite simply, the ball and the socket wear out. So the cartilage wears out and then the patient is bone on bone. That, of course is very painful for the patient, and they'll compensate in lots of different ways. The same goes on in the knee as well. The cartilage wears out completely and they're bone on bone. Of course, it's very painful. The joint can become deformed. They can put stresses elsewhere. So what we do is we do a scan. The scan goes to the company. The company then uses their software program, and that program will then result in essentially a 3D printing of an implant and the instruments required. And then we can literally match that implant to the patient, or we have an implant that is only going to fit that patient. And this is totally different to what goes on elsewhere. The actual process of the surgery is just the same. We remove all the damaged parts and then we replace it with an implant. Implants usually are what we call uncemented, so we have this exact fit that goes into the patient. The patient's bone actually grows into and onto the implant. It gives a really solid fit. What we had before was what we call cement, and cement used to wear out, so implants didn't last as long. We had bearing surfaces that wore out. Now we've got newer surfaces with less friction, so they last longer. And because the implant fits, it means then that the stresses across the joint are reduced, and it means the patient can make a much quicker return to the sports and activities that they want to get back to. So in my training years, as I came up, I was told, oh, well, you have a joint replacement, it's last resort, it's not going to last, you can't do what you want. It's completely different now. So now...
There's big hope, really big hope for these patients. So what's happening is really brilliant, and this medical field is advancing every day. The patient, let's say, came to Emirates Hospitals Group and saw you in any of our hospitals, and he did the surgery. So how many days he is supposed to stay in the hospital, and how many days or months he's required to go back to normal life?
True. So it's really interesting. So what happens now is the patient will come on the day of the surgery. They'll have their surgery that morning. Usually it's under a combination of anesthesia. We've got some very special techniques now in terms of how we do that on the anesthetic side. There's also various drugs that we're giving now that help us in terms of making sure patients don't lose very much blood, that they don't feel any discomfort post-procedure. So they wake up pain-free. We actually will get them up and they'll go walking that day, literally only a short walk, but it's still a walk, same day as surgery.
Wow.
The following day, they will literally walk up and down the corridors, potentially go up and down the stairs, and will be discharged out of hospital. So hip patients, 1 to 2 days, and knee patients,
Amazing.
2 to 3 days. So it's a really rapid recovery. They'll go home able to do stairs, to be able to potentially look after themselves. It's always good for them to have a bit of help to start. And then they'll come off their crutches, usually between about 2 and 4 weeks total, and that's it. So they should be able to walk, look after themselves, get around. Obviously sporting activity will start a bit later, but usually 2 to 3 months we'll be having them doing various activities. So it's rapid recovery now.
It's really rapid recovery. And I want to ask you that anyone is not fit for this kind of procedure, or?
It's actually, we will do a pre-assessment of the patients to ensure their fitness. If anything's highlighted during that process, it might involve having to see, for example, a cardiologist or an internal medicine doctor to make sure they're absolutely sorted, as it were. The surgery itself is very straightforward. To be honest with you, if they're anesthetically fit, then they're fit for surgery. It then just comes down to how badly damaged the joint is. But with these 3D planned implants, we can literally reconstruct anything. And to be honest with you, it's actually, of all the times you need 3D planning, it's with patients who do have significant disease.
Yes. So how does the patient know that he is now, he has to do this 3D joint replacement? Who are the people who have to take the decision, like with their doctors, of course, or the doctors take the decisions on their behalf that it's the time now?
So I think with any patient, it comes down to their quality of life. So how much pain do they have? Can they do the things they want to do? Everyone's a bit different. For some patients, a small little thing might be the big thing in their life that is life-changing for them, and they need to change it. For others, they can be really in a terrible state, and it's only then that they feel they want to move forwards and do things. So patients have different views in terms of where they are and when they're ready. I think it's all joint decision making, so we discuss all the pros and cons with them, and then they will make their own decisions in terms of when they want to do things. The surgery itself is very straightforward. 3D planning is really for anyone. It should be for anyone, because we want that exact anatomic fit for the patient so they can make that return to activity.
Yeah. With the surgeons, with your expertise, I think their decision is going to be easier, and their life for sure, the quality of life will be better. Thank you very much, Dr. Paul Jairaj, for being with us today in Al-Majlis Podcast. Stay tuned for more episodes from Al-Majlis Podcast by Emirates Hospitals Group.